Dental care is more than just care for your teeth.
There is a direct correlation with our oral health with also systemic health. Maintaining good oral health prevents heart attacks and strokes. There's this bidirectional relationship with diabetes.
And of course, you face the world with your teeth. You need to be able to eat well and smile well and function with their lives and apply for a job and keep a job and find love. Their mental health is really closely tied to having a good smile to present to the world.
Overwhelmingly, there is more dental disease out there than any tribal clinics can fully manage. I don't know of any tribal clinics in California that are able to effectively meet every person's needs in the community.
American Indian children experience the highest incidence of dental decay compared to all other groups of children across the country.
I've worked here 22 years, and as long as I've worked here, it's been an issue. Part of it's being rural, retaining and attracting dentists to the area isn't easy in general.
For example, in Humboldt, there's between 132 and 133,000 people, and we have about 35 to 40 dentists.
People just aren't willing to move to a rural community and then stay in a rural community. We built a clinic to be able to provide access to dentistry, and once our clinic was finished, we had an empty clinic because we couldn't recruit a dentist to fill the space.
In our area, we have dental programs, but when we don't have enough dentists, that affects accessibility because you can't get an appointment.
There's some offices where they're booked out 3-4 months. And then this little cavity that could have been filled now becomes an abscessed tooth.
It's quite shocking when they see the severity of the dental need here. They don't just need a little tiny filling or a cleaning. They have extensive treatment plans.
When I was in private practice in Los Angeles, I had never seen anything like this. It was a big shock to me. I was told about it, but I didn't believe it.
Because the lack of dental services, we don't have preventative services. We have emergency services. Our dentists are burned out at a rapid rate, and it's difficult for them to constantly see patients that are in pain.
I grew up in what we call the village of Watek, which is way down the river on the Klamath River. I grew up without electricity. And in order to access dental care, you have to drive at least 80 miles out to Arcata, which is a pretty significant long drive.
That's just if you have a car. If you don't have a car, you have to walk or hitchhike or get another way of transportation.
A lot of our tribal members live in poverty, and the finances are an issue for them. Transportation's an issue for them. Dental insurance is an issue. Getting time off from work is an issue.
So a lot of states across the country have faced these same issues, lack of access to care, a provider shortage, and a really interesting, innovative, indigenous-led solution is dental therapy.
Dental therapy really started in New Zealand over 100 years ago. It was found to be so effective there that it's now common practice in over 50 other countries. Dental therapists provide the most commonly needed dental procedures. In general, dental therapists can do dental exams, the simple cleanings, all of the preventive care like dental sealants, as well as routine procedures like fillings and even simple extractions.
The thing that stands out the most about dental therapists is their mission for underserved communities.
A really neat thing about the legislation in states that have allowed dental therapists is they authorize dental therapists to work under what we call general supervision. That means that the dental therapist doesn't always have to be at the same location as their supervising dentists. So dental therapists are able to provide care in the clinic, and very importantly, we see that the dental therapists can be out in the community, in community locations, so we see them in schools, on mobile dental vans, or even in long-term care homes. Anywhere that the care is needed, we're able to bring the care to the patients, and that provides such an important piece of increasing access to care.
We are able to provide a program where people from that community who are already established in that community are able to go to school to become health aid therapists. By training people who are already happy in your community to become therapists, you actually are able to have more continuity of care because those therapists are more likely to stay in that community.
It's also important to talk about cultural competency. A lot of dental therapists come from the communities that they serve, and this really matters in rural California, where providers are coming from the cities and suburbs. They're staying in rural communities for exactly as long as it takes to get their student loans repaid, and then they're out of there to private practice. Versus a dental therapist who comes from the community, gets educated, comes back home, and serves in his or her community for their entire career. So it's also a pathway to a good paying job for folks in communities that struggle with high unemployment.
Dentists in California would benefit from working with dental therapists. I think if we add dental therapists to the workforce, there could be many dentists in California that may have never considered taking Medicaid patients that are now able to take Medicaid patients because of a dental therapist.
Fewer than a third of dentists in California accept Medicaid patients because it doesn't financially make sense for them to do so. But a dental therapist is a more efficient workforce model, and they're able to work with the Medicaid population and see Medicaid patients in a cost-effective way.
The dentists that I know, including myself that have supervised dental therapists, have said, I would never want to go back. I love having this person on my team. They're able to provide so many of those routine services and freeing up the dentist to focus on those more advanced procedures. The more that you can allow people to work at the top of their scope of practice, the more effective your dental team is.
These are mid-level providers, and the scope of practice allows them to take care of patients who are urgent.
What I would ask is that people do the research, that people look at other states. There are many states that have the DHAP program, and they are being run very successfully.
To me, the dental therapy model is it's just like a no-brainer. It should be a legislative dream. This is a great educational model and a great solution to a lot of the issues we're facing in oral health care.
It's important to get in touch with your state representative and your state senator and tell them that you support bringing dental therapy to California. I would encourage tribes to join with the California Rural Indian Health Board to continue tribal advocacy for dental therapy in California. I would also encourage tribes to join the great folks at COHEC, the California Oral Health Equity Coalition. They're really leading the fight for dental therapy in California.
I don't think there's a good reason not to have this kind of provider in dentistry. There are not enough dental providers, and why not give an avenue for people to help their communities and help with the basic needs that everyone should have: dental care and a healthy mouth and no pain. We need to do better for our people and give them options for healthcare.
There's really no reason why in 2025 in the United States, someone should end up in an ER because of a dental abscess. There's no reason.
A rural mobile dental van, that would be like fantasy, amazing, awesome.
I'm so excited to see legislation moving forward in other states to get this desperately needed workforce out into the communities.